APNE, as you know, is the Association of Pakistani Physicians of Northern Europe, and we are the largest Pakistani Doctors Association, democratically elected in Northern Europe, and we represent doctors and allied medical and health services. Now, I'm going to be handing over the mic to our moderator for today. I'll just give an introduction. We have Dr. Suhail Zafar, who is a member of the Royal College of Psychiatrists and has gained an LLM in mental health law from University of Northumbria. He works as a consultant psychiatrist for Signet Health, an independent provider of specialist mental health services. His clinical special interests include rehabilitation psychiatry and autistic spectrum disorders. He also has a special interest in medical management and provides clinical management and service development leadership roles within his organization. Dr. Zafar, welcome.
Thank you.
Over to you.
Thank you, Dr. Latif, for lovely introduction. As you know, today's webinar session is chaired by Dr. Rubina Anjum. What to say, I mean, she's very near and dear to me. Dr. Rubina Anjum works as a community psychiatrist in general adult psychiatry with a special interest in adult ADHD. Dr. Anjum was involved in developing the service for South Staffordshire and Shropshire NHS Trust, and now you know it is now called Midland Partnership NHS Foundation Trust. Relating to the topic of the day, she receives transition cases of ASD and ADHD in day-to-day practice who are already prescribed on melatonin, which I'm sure you're aware of, its license in for children. So today's topic, sleep disorder, does interest her as it affects people in multiple ways. Just to mention, this program is being recorded, so if you have any issue with recording, just make sure. If you want to leave now, you can leave now. And also, I'll be looking at the Facebook for your questions. So please, it's for Facebook viewers. Please post your question on Facebook Live. Okay, so over to you, Dr. Anjum. Oh, you need to switch on your mic. Yeah. Yes.
Yeah,
that's it.
Thank you, Dr. Zafar, for your kind introduction. And I remember your training days with me when
yes.
years ago. That tells my age, isn't it? Yeah. So today is my sort of duty to introduce the speaker. It is my sort of, I'm delighted to introduce my old friend and colleague now. I've known him since 1989, Iftikhar.
Yes.
And a very warm welcome to everybody who's joined the webinar. Today's topic is sleep during pandemic and expectations and possible solutions. Iftikhar is going to go through that. I think it's very relevant, the topic, in the current COVID situation, because it impacted everybody globally and families all over the world due to the media coverage 24/7 and how the sleep got affected. So introducing Dr. Ahmed, he graduated from Rawalpindi Medical College. He initially worked in Pakistan and he trained there and did his diploma together with myself. He moved to UK before me and completed his basic training and higher specialist training in psychiatry in the Trent region. He has worked as a consultant adult psychiatrist since 1999, first in Sheffield, and then he moved to Walsall and Dudley Mental Health Trust. So during this period, he has undertook a lot of responsibilities. For 9 years, he remained a clinical director for community recovery services. And then for a year, he took a joint medical director sort of responsibility within the trust. Regarding training, he has got special interest. And he has been a trainer for core psychiatric trainees and medical students. He is a CASC examiner. He is an assessor for the Royal College of Psychiatrists. He was a member of Executive Committee of Royal College of West Midlands. He is an active member of Mental Health Act approval panel for West Midlands and East of England. So having all these accolades in his feather in his cap, I think I'm handing over to Iftikhar to introduce and go through the topic today. Over to you, Iftikhar.
Thank you, Rubina, for the kind words. Just want to correct one thing. I have been CASC examiner from 2002 to 2016, and then I had to give up because of
Okay.
issues. Now, thank you very much for giving me the opportunity to present on this sleep. Can you see my
Yes.
chair? That's
Yes.
fine. So one thing is, as a few months ago, while we were in the lockdown, I started noticing that the difficulties about the sleep, not only in my clinical practice, but also when we're talking to friends, when we're talking to the families, extended all over the country, that sleep was becoming an issue. At the same time, when I started reading, we know that
the people we have on the specialist register on the basis of European one, they'll probably not take it off retrospectively, but they'll probably
Hello?
not be
Hello, can you hear me? Can you hear me?
Yes, please carry on.
Okay, sorry. So that was the one background when I got interested in this topic. At the same time, as a clinician, we know, as a psychiatrist, we take histories about when we're seeing the patient, the sleep is how important in the clinical presentation in day-to-day clinical practice. But one thing is definite, that we actually do not know much about sleep in our day-to-day practice. So I thought, can you hear me now? There are some messages coming on my screen. Can colleague hears me now? So what I will do is the next 30 minutes, I will go through quickly a sleep refresher course. Unmove. How can I? Yeah. So the next 30 minutes, I will go through overview of sleep and its purpose. Just a recap. I know all of my colleagues and generally people know about this. And then I will briefly talk about corona pandemic and its some characteristics, then some sleep problem associated with it, and then possible solutions. So first of all is sleep. What do we know about sleep? Though we spend nearly a third of our life in bed sleeping, that is normal. But actually we do not know much about sleep. In the last 20, 30 years, there's a lot of research that sleep is not just the absence of wakefulness, which has been considered for a very long time. Now we know sleep is a very active process and it is vital for our health in so many ways, which I will go through in the next few minutes. But the important aspect is, just let me check where it says, yes. But the important, I think there is some issue, some problems. I think there is some, I will just go through quickly. And as far as I know, that's this sleep, that's how it is controlled. There are not fully understood, but there are different centers in the brain which compete with each other to keep us in a state of wakefulness, and then we go to sleep. And usually what we call is, there is a drive, or we call it sleep drive, which starts when we wake up in the morning, and it becomes stronger and stronger and stronger as the day passes. As compared to, there is a wakefulness state, certain parts of the brain, for example, in hypothalamus and in the brainstem, which is keep us alert. The signals from that passing on to our cerebral cortex keep us alert, while at the same time, through our what you call is suprachiasmatic nucleus, which is based, receives the information and is the basic for our circadian rhythm. It also keeps us, helps us in that system. But as the day passes, there are certain chemical changes happening in the brain. For example, there's a pileup of adenosine. And this tussle between the wakefulness state and the drive to sleep, which is keep us determine when we transition from wakefulness and into the sleep. Now, the important aspect on this is that when we go to sleep, sleep is not just one state. Sleep is what we call now is non-REM sleep and REM sleep, which is non-REM sleep means non-rapid eye movement sleep, which has gone through different stages. And the stage number 3 is when the deep sleep, when we normally are not responsive to what you call is ordinary stimuli. And in between the sleep structure through the night, it goes in cycles from non-REM sleep into REM sleep. And REM sleep is start with every 90 minutes. And as we progress through the night into the day, into the morning, the cycle becomes shorter and shorter. What does that mean is that when we have REM sleep, as our rapid eye movements, there is usually a paralysis of the peripheral muscles. And there's a theory is that it helps us not to act, because REM sleep is also associated with what we call is dreaming state. And if someone wakes up in REM sleep, there is a sleep, person can remember what you call is the dreams. Now, important aspect is the transitioning between wakefulness and sleep. That can happen quite quickly, and people sometimes have noticed that when they're tired and they're driving, there is an issue sometimes. It takes only a few seconds when you can just go from wakefulness to sleep. So that's the structure on the surface. But at the same time, there are a lot of changes happening in the brain while we are asleep. And I will specifically focus on the hormonal changes. I will give an example to start with. We will go through a list of, for example, growth hormone is mainly secreted during our sleep. And there is difficulties in certain mental health condition. For example, we know in PTSD, the level of growth hormones created during sleep is reduced. Similarly, we know that there's a cortisol level, there is a circadian rhythm where during the midnight and the evening and midnight, it goes down and then slowly picks up. Similarly, there are other chemicals, for example, ghrelin, which promotes food intake, and leptin, which suppresses our appetite. They are also have a very close link with sleep. Similarly, our glucose metabolism. It is really important that it also has an impact via the sleep. So how, keeping in mind all these chemical changes in the body happening, sleep is a really important aspect. It has effect on our physical health. And for example, in physical health, in maintaining weight, we know a lot of studies shows that when the sleep is disturbed, either we are sleep deprived or sleep is interrupted, it leads to quite common phenomena if you look at is comfort eating. And that leads to increased weight gain, leads to metabolic problems, and leads to type 2 diabetes. Similarly, we know that it has quite a big impact on our athletic performance. All the studies show that having a good night's sleep will have a good performance, especially in athletics, that we could have, it improves one's ability. Now, the important aspect is about heart disease and the stroke. There are a number of studies which show, though we haven't yet fully understood the mechanism, that sleep, if it is affected, has effect on our propensity to develop heart disease or coronary heart disease leading to stroke. So these aspects are important. I'm just touching this system, these issues. Now, the immune system, you know, there is a saying that the let sleep promote healing. It is a very close link with our immune system and in sleep. And I will give just a brief 1 or 2 liner on this aspect, that the studies have shown that during normal sleep, our undifferentiated T cells and cytokines, their level is increased, but in our wakeful state during the day, our targeted T cells, they are increased in number. Also, there are studies showing that if sleep is affected, it impairs the effectiveness of flu vaccine. So keeping in mind all these, it is just I'm trying to give a very brief description of the impact of sleep. And also about mental health, what we talk about mental health is, it is very closely linked with depression. We know there are a number of studies show that either sleep is on the, if we look at it's as a symptom of depression, or if the sleep is interrupted, in chronic insomniacs, we know the incidence of depression increases. Now, important aspect here, mental health, I will want to explain one thing. In this industrialized age, there has been studies showing that gradually we are human beings in industrialized countries, especially, we are sleeping less as compared to, say, about 50 years ago. One study in America has shown, as compared to 1960, in 2008, average American was sleeping 1 hour and 45 minutes less. So that has an impact. We know that concentration and productivity, if we are not sleeping, that it affects our concentration, and all of us experience about the jet lag, and if we can't sleep one night in the morning, we are feeling a bit groggy. And that has a direct impact on our emotional and social interaction. And just before that, one important aspect of sleep which we don't talk about is daytime napping. Now, pre-industrial age, it was, and especially in tropical regions and warm countries, and especially my colleagues quite remember, that it is not uncommon to have a nap in the afternoon in summer season. And this also happens quite a lot of countries still. Nothing wrong with that. But now the way our industrial age has changed things, that most of the people in at least industrialized countries, we have a consolidated 7 to 8 hours sleep at night. And if it is less, we are concerned. And even if we sleep during the day, we still feel that we need to sleep at night. One important aspect of napping during the day is what other name we call is power nap. If someone, it benefits, one should not resist it, but one has to keep in mind that it should be around 30 minutes, plus minus 5-10 minutes. Because if we have more than that, then we are likely to go into deeper sleep. And as a result, our sleep will be affected in the at night. So that was just briefly my introduction about sleep. And I now will look at what happens in Corona pandemic. First of all, what are its characteristics? First of all is uncharted territory. We, for the last 100 years, we haven't gone through this phase before, though there have been some pandemics, swine flu pandemic, Ebola in African countries, or SARS one, but that we have been able to control those. This COVID-19, which started in November, December time from Wuhan, China, I remember in January or in December, when we looked at the televisions and news were there, it seemed like it was in a far distant place. But the way it has affected the whole world, wherever you are, it is an uncharted territory. And then now we have coming out of this country, have come out of lockdown, but 3 months staying up in the house, children, adults, normal routine suspended. Our ancestors in the near past haven't experienced that sort of thing. At the same time, though it is now 8-9 months into this, 10 months into this pandemic, our understanding is still improving. We are still seeing how it is affecting our health in the short term, and we still have to see how it is going to affect our health in the long term. Also, at the same time, confusing signals from the health authorities, from the, especially if you look at in our country here and see what was happening in late February, early March, and hesitation and all those things, and still, so it is not uncommon that that's the characteristic. And then we have been through lockdown and quarantine, and now, though the lockdown is over, but still what we call is smart lockdown. Authorities are really keeping a close eye to make sure that it is under control. Because until or unless we have the vaccine, we do not have natural immunity to this illness. At the same time, we are not in 1918, when there was no social media, there was only few newspapers, there was no television, there was no radio, there was not as much. But this is the age of social media. Now you are bombarded with the news around the world. The whole world is in your palm, and the news about different countries, about all those aspects. So keeping in mind all these things are the characteristics of this corona pandemic, not only the physical illness, but all these associated aspects. What has happened to sleep during this pandemic? First of all is, in this country, there was a disruption of daily routine. We have, almost all of us, have a very structured 20 hours, 24 hours routine in our life. And you know, we human beings are creatures of habit. We have structures of the family. Everyone is expected what to do. Children are going to school. We are going to work, coming back. Then we have social life, the weekends, the parties, all those things. And suddenly in March, everything was suspended. Complete, full stop. And that led to, and the new routine started. We were not allowed to go out, maximum just for an hour, for a walk or so. The children, 24 hours at home. Most of us were working from home. That is a new concept, at least for me, but a lot of other doctors, how to work from home, doing the clinical and supporting for a big part of our life. Then anxiety, worries, and stress. About what? Now it is 6 months. Almost every one of us knows someone in our social circle or family who been affected by this illness. It has brought the bereavement. It has brought the anxieties, health anxieties. And especially in this country, when we look at the mortality rate in Black and ethnic minority group, so high, that has led to anxiety and stress, in addition to living in the house. Isolation. We are human beings, being a social animal. We love to meet people. We have parties, we have dinner parties, we go out at work, we meet other people. Everything came to stand still. And that isolation, though we use the media, but that isolation also started affecting us. We have to keep in mind this daily structure, which we have, it provides an anchor to us, as a anchor to give us an idea how the time is passing. 9 o'clock, work starts. I have to wake up at 7:30 or 7 o'clock. Then our ward rounds, our clinics, our office work, coming back home, children coming from school. So all these anchors during 24/7 have been removed overnight. At the same time, changing family dynamics. Apart from when we are, for example, on Eid or on Christmas or holidays, usually when the families are growing up, we have our own lives. Children growing up, they go to work or they moved out, or the children in the school, they have quite a big, and suddenly the timing changes. I'm working from home. My wife is working from home. I will give an example. My 2 daughters are working from home. Everybody is scooped up in the same place. How do we deal with that? Our traditional, for example, what we call is the Eastern model, we're trying to apply in West, is already under a lot of strain. And that has led to all these worries are accumulating. For example, we normally use bedroom to sleep, but if we are spending 24 hours at home and working from home, a lot of people are using bedroom as at workplace. And that has another aspect. Similarly, at the same time, if I'm not working, I'm not doing television, put on the television. And most of us have been hooked onto the news. What is happening in our town, what is happening in the country, what is happening in the world at large. And most of the time during this pandemic, the news were not very good. Then if there was anything left, that the social media fulfilled the, and actually my observation is it was really difficult to siphon the reliable news through this plethora of news and rumors and theories about whatever it is, and that caused so much anxieties. So that is it affects sleep. For example, if we are not working, does it matter if I wake up at 7 o'clock or at 10 o'clock when we go on holiday, or the weekend, we have a little bit lie-in. But if every day after day, week after week, months after month, that those daily anchors have been removed, the sleep pattern is affected. So that's up till now, I'm talking about the sleep. An important thing is as the day passes and we go in the evening and we are using screen time more and more, one important aspect we have to keep in mind is that most studies are coming out that on our screens, on our iPhone or our Androids, or the blue light is keeping our cortex stimulated. It has jeopardized our normal circadian rhythm, our normal biological clock. So that we have to keep in mind. So what to do in this pandemic when the normal rules were suspended? First is to please establish the routine. Our routines of the timings when we go to sleep and when we wake up. The routines when we have lunch, dinner, the routine when we get up in the morning, and even if I'm working from home, to get up and get ready to go into that mode. That routine is a really important aspect, which I have found with my colleagues and the patients and others, that people have really struggled to keep that routine. The other is a diet and exercise. We are sometimes become lazy. Our eating habits, we are starting using more and more, and there are some observational studies are coming up that people are using more junk food, comfort food. It helps us to stay relaxed, there's no doubt about that. And what about exercise? What happened to all those gyms and all those health clubs where we were using our time, most of us? For example, I used to play badminton regularly. It was just taken out. And I have to fill that time. And that exerted, you have to have an effort to do that. Restrict screen time, especially the news. From the very beginning and after the first week or so, we started looking at that aspect, and I restricted for myself and my family, plead to them, because I can't overrule them, suggested that we have news only once at 5 o'clock when there was an update from Downing Street. Otherwise, I would prefer to watch only Fools and Horses, just to keep myself sane. So we have to cut down, and especially cut down the rumors, the theories on the social media. Also, at the same time, we have to drugs, alcohol and caffeine, especially in the evening, we need to cut down. We need to make sure that we are reducing the light before go to sleep, especially blue light. I have recently learned how to reduce this blue light on my iPhone and on my screens, thanks to my children, because I was worried about that I'm doing so much screen time. Practice winding down. But the problem is, when we have been at work whole day, we come home and then we wind down do. That's understandable. But if you are at home the whole day, how do we wind down? The same faces 24/7. So that's a really important aspect, is the evening winding down. Keep the lights on the low if you have dimmer. If you go to bed and if you can't sleep for more than 20 minutes, please leave the bed. Do some light activity. Read. Do not drink coffee. You can have some other hot drink. But do not come back to the bed until you feel tired. Because being creatures of habit, we very soon get into that mode that go into bed. Our brain starts busy and we're tossing and turning. And one important aspect is, usually quite a lot of negative thoughts are coming to mind. And those thoughts take their own life, and their anxiety is induced and sleep is pushed back. One very practical thing is, please get up and write down those thoughts. Once you have done that, and if you do practice, you will see it works. And wake up on time in the morning. So that is just briefly, I've just mentioned on. I'm handing over to my colleague, to Rubina. Thank you.
Right. Thank you, Dr. Ahmed, for covering a big topic, which is sort of in half an hour was difficult to cover, but you've done a very good job in looking at am I on the screen? Let me see what I've done.
Yeah.
Wait a minute.
Yeah.
I've done something wrong here. Am I okay?
No. You are on the screen.
Yeah, okay, right, all right. Right, so the house is open to questions. So by the time I think Zafar gets his questions for Facebook, I think I will open with my question if everybody's okay with that. Yeah. Is it okay, Zafar, if I ask the question? Yeah. So my burning question to you, Dr. Ahmed, is you're using your experience, maybe it's not related to pandemic as such. You know, this issue of, because I've been in adult psychiatry for a long time, and chronic insomnia is a big issue, and a lot of patients come to you with the chronic insomnia, prescribed medications, and taking them off the Z drugs and benzodiazepines. There's a lot of discussion about de-prescribing. What are your thoughts about Z drugs and de-prescribing? Could you shed some light on that?
The one thing is that the medications, Z drugs, others, they have their role, but we have to keep in mind they have a role in very specific situations. What we are dealing there is, at the moment, is at a mass level of a situation which has affected our daily routine, which has caused a lot of problems. My only concern is that we should be very careful in using these drugs. or any other hypnotic, just for the simple reason because of their dependence potential. But there are other strategies, like, for example, sleep hygiene. We should use those. We have to keep in mind a lot of people during this pandemic. Actually, the studies show, I just want to digress, is that UCL in London, from April onward, they were doing a study. They found out that on average, people in Europe have been sleeping more during this lockdown. But it is the feeling of that feeling rested in the morning or sleep, or that is affected. And even if I have a sleep during the day, somehow I had this concept that I also need to sleep at night. So these are basic concepts I think we need to help people to understand. So Z drugs have their role, but not necessarily.
Thank you. Zafar, do you have any question?
I saw one question from one colleague: is insomnia a disorder or a symptom? And I think that's really interesting. We have to look at. We have to keep in mind that the sleep, on average, we have 7 to 8 hours, adults, and all of us have our own routines. Our situations, our circumstances change. If I'm working, for example, in shift pattern, my working habits are, then my sleep pattern will be completely different than the person next to me. Does it make sense? So in that sense, we have to be very careful when we say it is a symptom or it is a problem. This our understanding that everyone has to sleep at night is not true. That's one aspect we have to keep in mind. In certain conditions, it is a symptom. For example, in depression, it's a symptom. Anxiety. But at the same time, there are conditions called primary insomnia, where it is a difficulty, where people find it difficult. I will give an example. There are so many variations. I didn't want to go into too technical about the sleep aspect. We know about obstructive apnea. Their sleep is interrupted. And that's we know what's happening in that aspect. So it is really important aspect is that not only the duration is important, but it is a timing is also important, which it is suitable to that individual's lifestyle. If I am working, for example, long-term night shifts, then my sleep pattern will be during the day. And there's nothing wrong with that. Okay.
Thank you.
I don't see any questions on Facebook, so have you got any further questions?
Yeah, Dr. Ayman, I've got a question. Do you have got any experience on using tricyclic antidepressants for insomnia?
Again, we are going into technical aspects. Yes, there are use of, for example, recently I have been involved with patients with amitriptyline, but these are the very technical situations where we have to, as a clinician, we assess the situation. We look at the history, the clinical pictures, what sort of medications patients has been prescribed before, and then we make a decision with that individual about the needs. But short answer is not in routine. No.
Right, there's a question come up. How much sleep would you consider to be normal in terms of hours?
Okay, now the sleep is different at different ages, as we know, and the quality and the type of sleep is also different. That we have to keep in mind. For example, in infants, newborns, if we look at, they usually go straight into REM sleep. They do not sleep for a long period. They just get up, then sleep, they get up and then sleep, they feed and they go to sleep. So that pattern is different. And it takes around up to the age of 6 months before the normal pattern of sleep is established, which is we can decipher on EEG. As we grow older, that need for sleep is actually, the duration is going shorter and shorter and shorter, to the point where we have, for example, on average, it is on average, that important aspect you have to keep in mind, between 6 to 8 hours. And that's some other important aspect, is 6 to 8 hours. And there are variations from individual to individuals. During adolescence period, it is a bit longer. And there are studies coming up which shows that actually, generally, the adolescents, they are not morning people. And my personal communication with one of my friends who is academic in a university, when we were discussing about how working patterns have changed, his view was that since the lockdown, they changed their practice of lectures online, and actually they were doing in the late evening, and the attendance was 100%. And he mentioned that the question has been raised, what are we doing in the morning? Why we are wasting time in the morning if that's not what's happening? So, and that's how much it is a very individual, but the important aspect is that we have to keep in mind the feeling of being rested and refreshed. That is important aspect. Because if, for example, you will see people who have slept 6-7 hours, but when they get up, they don't feel rested and they say, my sleep is rubbish.
Thank you. There's a sleep doctor who says 9 hours now. And when you said
Yes.
it's pandemic, it's reduced. The Americans have reduced by 2 hours. So that is great. There's another interesting question. Do dreams protect our sleep? It's from Dr. Sohail Ahmed, I assume, if I can say the name.
Now, we are in,
Interesting.
as we are still trying to understand sleep. What I described you, it was just a very small portion. Sleep is protector of our health. There is a saying, and actually our normal state is sleep. We just, human beings or animals, we stay awake to feed ourselves and then go back to sleep. Dream, what sleep does is it restores our processes, the things what we are doing, and brain and all those things. Where do we fit these dreams in? One thing is definite, that if REM sleep is affected, it will have a big impact on how we feel in the morning. It will affect our concentration. It will affect our ability to perform at our optimum level. I don't want to go into psychodynamic and other psychoanalytic theories about the dreams, but there is no doubt that dreams are important. And other concept I take this opportunity of. There is a concept called sleep debt. What that means is that we cannot shorten sleep artificially. If someone's sleep is affected, our bodies will have its share of that sleep, and after that, they will go back to normal.
Right.
I don't want to just do this talk too technical. I'm trying to keep it simple.
Okay, thank you.
I just
Any question now come up on Facebook too?
No, I'm afraid there's
I just
nothing on
want to
Facebook.
make a comment. Can I
Yeah.
ask a question?
Yes, yes.
Thank you. My name is Kamila Heather. I'm just not on video. Actually, I'm audio.
Yeah.
Assalamu alaikum, Dr. Sohail. How are you?
I'm fine, thank you. Nice to hear you.
Nice to see you here. I don't know if it's a question or an experience I would like to share with you.
Yeah.
I work in forensic unit, and the patients are usually locked down there, and for them it's like a lockdown for maybe months because they don't have Section 17 leaves and things like
Yes.
that. So, but it's rather sad to see them that they're already in a lockdown when we all went in a lockdown, and then experience what these patients would be experiencing on the wards.
Yes.
So it's the reason why I'm sharing this is that most of these patients do have a lot of sleep problems. We offer them sleep hygiene programs from psychology, from occupational therapists, Z drugs that we've just talked about. A lot of therapies are being done, but actually the problem is not this. The problem is all that psychosocial aspect that is going around their life, being locked down for months and months, and there's no goal to act to, there's no hope. There's this lot of things that they can't do outside this world, outside the ward in this world. So for such kind of patients, what would you like suggest? And I just want to share one experience that one of my patients literally tried everything on him. And after, once in a ward round, he turned up saying, "Doctor, I'm having a good sleep." And I asked him, what did you do differently? And he said, "I've been having this tea from Twinings. It was a turmeric tea." And I tried that tea after, like when he told me, I tried that. And it worked. So I don't know whether it's right or wrong. After that, or not, all our staff started using it. So we have those turmeric teas somewhere in our cupboards, all of us. So just a experience I want.
Anecdote. That's fine. One thing is we have to keep in mind, you are right. Our social circumstances have a big impact. There is no doubt about this. Our sleep is our physical health, our social circumstances. There is a bi-directional relationship between these things. If there is too much temperature, if it is too hot, if it is too cold, if my physical health is not well, if I'm in pain, if my bed is not comfortable, if I'm concerned about something, all these things are affected. There is no doubt. And I think now we can empathize with these patients who are locked up 24/7 out for a long period. And the anecdote you have given about this turmeric tea, one thing we have to keep in mind is with the sleep is every individual is different. If something helps, that's wonderful. I think that's nothing wrong with that person should use it.
I can add to that. It could be because I was reading a lot by the sleep doctor, Dr. Bruce.
Yeah.
And it, like Dr. Ahmed mentioned about immune system.
Yeah.
So turmeric is famous for
yes.
with the immune properties. So if sleep helps immune systems, turmeric helps immune systems, it could be that vicious cycle has improved. So
Thank you.
While we are sharing these experiences, I just want to highlight one thing. In clinical practice, a few years ago, when we were really in summer was really quite hot, and in our hospital, the wards were not air conditioned. Suddenly I noticed that patients were, because at that time I had some management responsibility, and I was looking at the drug card and all those things, and realized that in 1 week, there was too much use of Z drug on the PRN and too much use of lorazepam and other drugs. So I went around and I spoke to the staff and manager, and the main issue was that the patient couldn't sleep. They were just awake the whole night in the lounge. And I said, why? What's happening? And then realized the new regulation, because you can't open the window for more than a few centimeters, health and safety, and it was too hot. And because they couldn't sleep, the use of Z drugs and other benzodiazepines increased, which I immediately stepped in, discussed with managers, and we came up with alternatives to support them. So I agree with you. And we need to look at the circumstances and every individual is unique.
Can I add a comment?
Yes,
yeah,
please.
I'm a child and adolescent psychiatrist. So what I wanted to say was that in autism spectrum disorders and in ADHD, the sleep difficulty is an inherent part of the disorder.
Yes.
And actually, recently there have been people been thinking that ADHD is basically a sleep disorder. So that was the comment. And my question to you is, you haven't mentioned anything about melatonin.
Yes, the issue is, I will come back, because there is so much, and melatonin, I left it. Melatonin, just briefly, I will say, melatonin is a part of our, what we call is biological clock. And its level pineal bodies is secreted and it goes up and down, and it helps what I mentioned earlier about sleep drive and the wake drive and how they keep push and pull each other. Melatonin is a central theme in that. One important aspect is lately, a few colleagues asked me if we should prescribe melatonin routine, and I said no. There are very specific things. If someone has some problem with the sleep, we need to understand from where that sleep problem is coming. And then if there's a need for melatonin, then we can use it. And I agree with Shahid with your comment about ASD or ADHD, that maybe they are sleep. And my view is, as our understanding moving forward, a large number of psychiatric problems could be one day considered primarily derived from sleep issues.
That's true. But most of these psychiatric disorders actually do affect sleep. Even your
Sleep,
dementias, they fundamentally
Yes.
affect your
Yes.
problems. Yeah.
Yes.
Melatonin, I think, only recommended to use in autism spectrum disorder children who have definitely sleep difficulties. Otherwise, we don't really use
We
it.
don't, yeah.
We don't use it.
Thank you, Iftihar. So we have I think 5 minutes left. So thank you for a lovely presentation and answering all the questions. And
Thank you.
sorry, Dr. Ahmed, I mentioned your name as Sohail rather than Shahid. So apologies.
No problem.
I will pass over to now Zafar to close the session. Yeah.
Thank you, Dr. Anjum.
Thank you, everybody. Thank you, all the participants, for attending and being active participants in this seminar. Thank you.
Okay, so thank you for joining. So before closing down formally, just a couple of announcements. Firstly, if you'd like to have CBT points, please email to Apne for CBT certificate. Secondly, please note that next webinar session will be on Wednesday, 5th of August at 6 p.m. The topic is about managing the potential stress of organizational change during COVID-19 for HCPs and medical leaders. This will be delivered by Dr. Shahid Latif. It will be chaired by Dr. Mateen Durrani and moderated by Dr. Shahid Qureshi. So please do attend the next seminar next Wednesday. And lastly, I would like to thank the Apne Mental Health Task Force for arranging these webinars. So thank you, everyone. So
Thank you.
I'll see you next week then. Thank you, Dr. Ahmed. Thank
you.
Lovely.